Hi again, welcome back. Here's some information for you that's important. Cervical cancer is common among women worldwide, but thankfully, the latest screening methods can detect it early before it develops. And Brad finds out more reasons why cervical cancer awareness is so important.
Good morning, doctor. How are you?
Good morning. How are you?
Good. Give me a little bit about background about you. It's very interesting what I've been reading about you and how incredible you are, of course, of fighting cancer.
Morning. So I'm Dr. Enyenamaga-Masu. I'm an OBGYN physician, and I'm the department chair of Adelante Healthcare. I moved to the United States about 12 years ago from the United Kingdom.
So, and we're talking, of course, Cervical Cancer Awareness Month was in January, but it's still important to know about this, and it's important to our viewers. Tell us a little about that.
Yeah, so cervical cancer awareness is very important because cervical cancer is a common cancer in women worldwide. And approximately up until 40 years ago, it was actually the most common cause of cancer death in women. So this has largely been reduced secondary to the cervical cancer screening and in part due to the HPV vaccine, HPV virus vaccination. The screening is important because it does pick up some cells in their early stages of change, which can prevent them from turning into cervical cancer. And it can also pick up cervical cancer in the early stages, and that can make treatments more successful.
Yeah. And
the types of
Oh, go ahead, doctor.
Also, the types of screening vary depending on a person's age and the type of test that's performed. But in general, we're asking everyone in the population with a cervix to start the screening above age 21.
Well, and Adelante is making sure that screening is easy for everybody, accessible. Let's talk a little about that and how important that is to our community.
Yeah, so absolutely. Adelante is a community-based health center. And at the heart of our mission is that everybody should have access to healthcare. So we make it very easy to make an appointment. Appointments have very short wait times. And at times you can even make an appointment for the same day visit. And we're accepting patients with and without insurance. And we can also help navigate and help you obtain an insurance, or for whatever reason, if you cannot get insurance, we also have low-cost healthcare plans that can meet your individual needs and your income needs also. And we participate in a women's health women's health program that does cover the cost of the visit, the screening, and possible biopsies if indicated.
Doctor, let's talk, of course, about screening and how important it is in early detection and who could be at risk, of course, of this cancer.
So screening in general begins at age 21 with anyone with a cervix, and that is regardless of sexual history, gender identification, or orientation. And the screening in general depends on a person's age and the type of test. So there are some tests such as the pap smear alone or high-risk HPV testing or a combination of the two. And the follow-up and the routine screening would really depend on possible results and the age of the person who receives the test.
Yeah.
But in terms of risk factors, the high-risk HPV infection is one of the most known causes of cervical cancer. And there are two specific types that we look for, 16 and 18. And then in addition to that, anybody who has a health condition that might make it difficult for them to fight infections, there are increased risk. And then people who also are not able to, have not initiated screening or have not followed up on abnormal results or been able to access healthcare may be at higher risk because we were not able to screen for cervical cancer.
Yeah, again, this is so important. I'm so glad you're here joining us and tell us about this. Tell how people can find out more information of what, again, your team and hospital is doing, the healthcare program is doing to make sure that we are getting a hold of the cervical cancer, of course, and taking care of people.
So Adelante is accepting all patients, and that's patients with and without insurance, regardless of immigration status or sexual orientation or identity. We want to screen all patients for preventative health because this is a way that we can prevent these cervical cell changes and potentially find cervical cancer early or prevent it. And we are really accepting people with And without the insurance, we're trying to help you navigate the insurance process if you haven't been able to get one and you are eligible. And we also have a lot of low-cost programs that do meet your individual needs. So, for example, if you have lost your insurance for any reason, or you're not employed, or you weren't able to get insurance, we can cover that, and we can also assist you.
So, Doctor, thank you for joining us and giving us this information. Again, we have information on aztv.com about Adelante Healthcare and how they're taking care of those. So thank you very much, Doctor.
Thank you. I appreciate your time.